Your doctor says it's depression and hands you an antidepressant, but what if it's actually your hormones? Many women who seek help for menopausal symptoms are misdiagnosed with depression and anxiety. Hi, I'm Dr. M, an integrative psychiatrist. Today I'm talking about the dangerous overlap between depression and perimenopausal or menopausal symptoms. Imagine this. You wake up feeling like you're moving through mud. Your thoughts are foggy, you can't remember why you walked into a room, you burst into tears over nothing, and your sleep, forget about it. Is this depression or is it menopause? Here's what's shocking. These conditions share nearly identical symptoms, but treating the wrong one can leave you feeling worse. I'll reveal the 3 critical signs that tell you it's hormones and not just your mental health in just a moment. But first, let me tell you about Maria. Maria came to my office after seeing 4 different doctors. Each one told her she was depressed and prescribed a different antidepressant. None worked. Some made her symptoms worse. She was starting to believe she was broken beyond repair. But Maria wasn't broken. She was experiencing hormonal chaos, which didn't necessarily require antidepressants. Now, during perimenopause, which can start as early as your late 30s, your estrogen doesn't just decline gradually. It fluctuates wildly, sometimes spiking higher than ever, then crashing to new lows. These hormonal roller coasters directly impact your brain chemistry. Estrogen isn't just about reproduction. It's a powerful neurochemical that affects your serotonin, dopamine, and GABA activity. These are the exact same brain chemicals targeted by antidepressants. So here's what your doctor might miss. When it's hormonal, standard antidepressants often don't work well without addressing the underlying hormone imbalance. Now, let me share those 3 telltale signs that your symptoms are more likely hormonal than pure psychological depression. Timing and cyclical patterns. Depression tends to be consistent day to day. Hormonal symptoms often fluctuate. You might have good days followed by crashes. Many women report feeling worse during specific times of their menstrual cycle or experiencing symptoms that come in waves rather than constant suffering. Physical symptoms cluster. Depression certainly has physical symptoms, but when you're experiencing hot flashes, night sweats, new joint pain, and vaginal dryness, along mood changes, that's your body screaming hormones are involved. I'll share a complete symptom checklist in just a minute that you can take to your doctor. Response to interventions. This is crucial. If standard antidepressants haven't helped or have made things worse, it might be because they're not addressing the root cause. I'll explain exactly what treatments actually work later in this video. But wait, what if it's both? This is where it gets complicated and why so many women suffer for years without proper help. Here's what your doctor may not have told you. Hormonal changes can trigger depression, especially if you have a history of mood disorders. A study found that women with no history of depression are 2 times more likely to develop depression during perimenopause. Think about that. Your change in hormones can actually make you more likely to develop depression. And if you've had depression in the past, your risk of recurrence during perimenopause is significantly higher, possibly double or more. In some studies, up to 80% of women with prior severe depression had a reoccurrence when estrogen levels dropped. I see this complex interplay daily in my practice. Women come in convinced they're losing their minds when really their bodies are going through a profound biological shift that affects everything from their sleep to their stress response. Before I share the exact questions to ask your doctor, let me tell you why this matters so much. Some women see multiple doctors and may not get the right help or diagnosis at first, leading to frustration and long delays. The average length of perimenopause is about 4 years, but it can last up to 8 years for some women. That's nearly a decade of your life spent feeling exhausted, foggy, and emotionally unstable. A study showed that many women who eventually received hormonal treatment had previously been prescribed antidepressants. This means that while you're taking medications that aren't addressing the root cause, your bone density could be declining, your cardiovascular risk increasing, and your brain health deteriorating. So feeling better starts with the right diagnosis. Now let me give you the exact tools to determine what's happening in your body. First, if you're between 35 and 55 and experiencing mood changes alongside any of the symptoms, Hormones should be investigated. Sleep disruptions, especially waking between 1 and 3 a.m. New onset of anxiety or panic attacks, memory lapses or brain fog, hot flashes or night sweats, irregular periods or changes in flow, joint pain that seem to move around your body, unexplained weight gain, especially around your middle. Second, ask your doctor for these specific tests. Thyroid panel including TSH, free T3, free T4, and thyroid antibodies. Comprehensive metabolic panel, vitamin D and B12 levels. Some doctors may also consider estradiol and progesterone levels. Third, and this is critical, track your symptoms daily for at least 1 month. Note their severity, timing, and any patterns related to your cycle or stress levels. This data is gold for proper diagnosis. But what happens after diagnosis? That's where things get interesting. The treatment approach for menopausal depression is fundamentally different from standard depression treatment. Here's what works. For primarily hormonal symptoms, hormone therapy can be transformative. Studies show that hormone therapy can reduce depressive symptoms in perimenopausal women, especially when started early in the transition. However, it is not a one-size-fits-all solution, and treatment should be tailored to each woman's needs. For women with both hormonal changes and clinical depression, a combined approach works best. This might include low-dose hormone therapy to stabilize the fluctuations, targeted antidepressants that work synergistically with hormones, lifestyle interventions. Speaking of lifestyle interventions, let me share 3 evidence-based strategies that help with both hormonal and depressive symptoms. Number 1, targeted exercise. Not just any movement, but specific types. Research shows that 30 minutes of zone 2 cardio, where you can still talk but not sing, 3 times weekly, plus twice weekly strength training optimizes hormone balance and brain chemical function. Number 2, chronobiology alignment, syncing your activities with your body's natural rhythms. This means morning sunlight exposure, limiting blue light after sunset, and eating within a 10-hour window. These simple shifts can reduce hot flashes significantly and improve mood. Number 3, anti-inflammatory nutrition. Specific foods like ground flaxseed, cruciferous vegetables, and omega-3 rich fish can reduce inflammatory markers and depressive symptoms. I talk about this more in my weekly research newsletter. The link is in the description. Remember Maria, after proper testing, we implemented a comprehensive approach. Within 6 weeks, her brain fog lifted. By 3 months, her mood and sleep were back to normal. And she told me, I feel like myself again for the first time in years. Or consider Jennifer, who had a history of depression that had been well controlled for years until perimenopause at 42. Standard antidepressants weren't working anymore. By addressing both her hormonal shifts and updating her depression treatment, she not only improved but told me she felt better than she did in her 30s. These aren't rare success stories. This is what's possible when we correctly identify what's happening in your body and mind. Before I share my final recommendations, there's something critical you need to know. Many healthcare providers receive minimal training on menopause, as little as just a few hours in medical school. This means you need to be your own advocate. If your doctor dismisses your concerns or says you're too young for menopause, despite your symptoms, seek a second opinion. Perimenopause can begin 8 to 10 years before your final period, often starting in your early 40s or even late 30s. And if they suggest antidepressants right away, ask, could my symptoms be related to perimenopause or hormonal changes? So, is it menopause or depression? For many women, the answer is both, and treating only one side of the equation leaves you suffering unnecessarily. This next video talks about how to treat depression with the most prescribed antidepressant in the US.